Running an ambulatory practice today isn't simple. Leaders are balancing patient care, staffing pressures, financial performance, and rapidly changing technology all at once.
Welcome to In Practice, a podcast focused on the latest in ambulatory care, what works, and what leaders need to know to help their practices thrive.
Hi, everyone. I'm Jenna Hagan, Vice President of Product Marketing here at NextGen Healthcare, and this is In Practice, a podcast where health tech leaders, clinicians, and practice administrators discuss the challenges that ambulatory healthcare practices face every day. And today, I'm really excited to be joined by Aditya Bansod, co-founder and president of Luma Health, a company focused on transforming patient access and engagement. As a thought leader and an expert in patient experience space, he's been thinking deeply about how AI, patient access barriers, and workflow fragmentation are colliding and what it really takes to move forward to be more connected and get that end-to-end experience. So really glad to have you. Thanks for joining.
So happy to be here. Thanks for the invite.
Yes, absolutely. So I know we've got a little bit of time together today, and we could probably talk for days on this
Easily.
topic. But patient experience, it used to mean, satisfaction scores, right? It's transformed so much from pressures of just making sure we provide access, speed, but also that digital convenience or modern experience. Talk to me a little bit about just some background of your organization, what you're seeing, and how those expectations changed over the past couple of years.
100%. So again, thanks so much for having me on the show. Really excited to be here. And I think that's a great sort of setup for where this story that we've been on at Luma came from, which was we've all been patients. Like Jenna, you've been a patient, like I've been a patient, between death and taxes, like being a patient's one of those like fundamental things in life and seeing a doctor. But that experience of seeing a doctor is just never straightforward. Like from the moment you want care to the moment you receive care, the path from A to B is like it's, A to Z to Q to R to M to B to eventually land where you want to go, which is start your path to healing. And, the world that I've operated in, we founded the company in 2015 with a really, really simple purpose, which is needing care is hard, but being able to get care shouldn't be. And really, that's sort of been the raison d'etre, like the why we've existed for a really long time. And while what we've aimed to solve hasn't changed, kind of how we've aimed to solve it has really changed a lot in the last 10 years. And I've been saying this a lot, especially since you kind of, dripped in a little bit about AI, which is I think if you ask people in ambulatory care, are no-shows a problem? Are patient satisfaction a problem? Are provider burnout a problem? They would have probably answered the same to that question in 2026, 2016, 1996, 1986, right? Like that problem has been there really for a very long time. But now I think with the tools in front of us, we have a lot of different ways to go tackle that problem. So what I've really seen change kind of since we founded the company in 2015 is the problems are ever present, but kind of how we tackle them has changed quite a bit.
Yeah, that's awesome. And what type of experiences do you think, as it's changed, are patients now expecting out of it, right? It's table stakes in some degree. I know when I look for healthcare as a patient, if you don't have self scheduling, if you don't have an easy way for me to send a message and get into the organization, I can't go there simply because I just don't have the hours in the time of day to make a phone call or drive to a location. So, talk to me a little bit about those experiences and how patients are expecting it.
I mean, I'm a shopper, right? I'm a shopper for clothes. I'm a shopper for, everything. And just as much, I'm a shopper for healthcare too. And I think one of the biggest shifts that we saw was really at like 2020, 2021, right? Where we had the opportunity for everyone to experience like mobile consumerization. So you got your DoorDashes, you got your, Uber Eats, you got all that sort of stuff where I suddenly had every restaurant available to me. I didn't have to go drive or pick up the phone or, have the piece of menu that someone had like left on my front door for the Chinese takeout. And so people got used to this level of convenience. And so when we opened our eyes and we said like, hey, I want to do this on the web as well. I'm a shopper for my healthcare services. That expectation went from being healthcare is hard to like healthcare should be easy. And I've recently kind of gone through my own journey on this, which is kind of funny to share, which is I had like a GI issue and I was a shopper for GI services. And I have a big, like large IDN near me in Dallas. And I won't name names, but a big, large, 20 hospital, 25 hospital IDN. And I was like, okay, I'm going to go see a gastroenterologist at this academic medical center, right? And it just like calls after messages, after missed calls. I was like, forget it. I'm just going to go see an ambulatory provider. I'm an insider in this, so I know what that's going to be. I was seeing 3 days later. Right. And so because I'm a shopper too, and my expectations went up too, this when I want care, I want it on my terms. Right. I don't want it on the terms that's dictated by some large anonymous faceless corporation where, The process of getting care is really, really hard. But, I want that to be easy too. And you asked Jenna the question around like how patients' expectation change. That's really the big piece for me is we all expect it to be as easy as it is to order DoorDash, which I love that. I mean, it's so many, and I'm sure you're in a lot of meetings. Like, I want the Domino's pizza tracker experience. Well, like the difference between pepperoni and mushrooms on a pizza is different between an MRI with contrast and no contrast. It's like it couldn't be more different. But
Right.
I, the consumer, don't care. Like, I want it to be that easy.
Yep, that's exactly right. You know, I still hear it today as much as I heard it 10 years ago of, well, my patients are in their 80s or 90s or 60s, or they don't have access to technology, or, my grandma's not going to schedule an appointment online. And data is absolutely proving that false. Patients are expecting modern experience. In fact, I always love that data point that your team shared at one point where a 93-year-old scheduled her appointment a mile from the practice at 2 a.m. And that is absolutely the age population that would have gotten in the car the next day to drive to that office a mile away and schedule that appointment.
Oh, 100%. One of the funniest things that we saw, so when we founded the company in 2015, we had, very similar kind of story here, like not just the one from that 93-year-old, but you look longitudinally across the patient behaviors across different age cohorts, you'll basically see that the 60s, the 70s, and the 80-year-old patients are the most engaged in digital technologies because they're just bigger consumers of healthcare, right? And, they've gotten used to seeing, the text messages for the photos of their grandkids. They're they're talking about book club with their friends in the neighborhood, right? Like they are digital natives now. And so
Yep.
that's sort of, it's the 93-year-old who booked the appointment at 2 a.m. It's also the 70-year-old who replied to a text message or booked online. It's the 50-year-old who like scheduled preventative care. You see it across every cohort now where the behavior is just there. We're all digital natives at this point.
Yeah, that's exactly right. Such a huge bucket of that too is change management, not only for the organizations adopting technology, but for their patients leveraging the technology. Change is hard. Change management to onboard, accept, train, continue, improve, optimize is a real thing. I want to circle back to no shows for a second because I think that's a really great example of change management or the
Yeah.
fear of and restricting it. When I was in practice in orthopedics, a follow up was not just a follow up, right? It was it PRP 1, 2, or 3? Was it a post op? Was it an MRI
Totally.
review? Patients just knew they had to come back in. They didn't know why they had to come back in. So I, at the time, was scared to let them self schedule because I didn't know that I could intelligently route it appropriately to help them get that follow up in. But more so, had I known back then that I could leverage a self-scheduling technology to just let them reschedule, keep them on the books and pull that integration is driving. I mean, we've got organizations out there that we're seeing improving no-shows up to 40%
Yeah.
just by leveraging technology, not a way that they think about it, right? Or that they're scared to. Um, so I'm curious about that and just some of the change management, how we're helping to overcome some objections or why wait in adopting some of these technologies?
Yeah, I mean, I think, you know, I get the opportunity to talk to a lot of CIO types, and there's a fun kind of game you can play if you have multiple in front of you. Just this will be long winded, and you know me, Jen. I'll get to a point eventually, but it might take some time. Which is you do show hands. Who's got a no show rate of 10 to 15%? A third of the room raises their hand. Who's got 8 to 10%? The other third. Who's got between 5 and 8%? The other third raises their hand. Who's got below 5? And like almost nobody raises their hand. And you say, or there might be the one person in there, and they say, you ask them like, well, how did you get below 5%? How did you get below 4%? And they're like, every version this comes out to, we basically got lucky. And but the range get between 15 and 5% is absolutely an operational process. Getting below 5%, you're fighting human nature. So let's talk about that 5 to 10%, 5 to 15% range we can work down. And I think when you look into this, there's a couple different buckets on this. One is there's demand. You can fill in slots more. You can double book them. You can do online advertising. You can do business development through referral partners. There's demand side. And then there's the booked appointment optimization side, right? Which is exactly the point you're starting to get at, which is Jenna's booked for a post-op eval at her ortho. She made no show that, but instead of no showing her, can she reschedule it so that we can match supply and demand more effectively? So I think health systems and clinics and ambulatory practices, when they really start thinking about not just the demand side and the patient behavior side, which is like, I'm going to have a no-show fee. I'm going to double book. I'm going to do all these sorts of things. I'm going to harass them with 7 appointment reminders. Like when they get beyond that and they really start to think about who is booked as my revenue opportunity, make sure there's liquidity and availability to let that have some movement because human nature is true. Like my schedule's changing next week and I literally have a doctor's appointment I need to reschedule next week. When you allow for that, you actually end up getting, and that's why I see the big dip below 10%. So kind of the 15 to 10% like range is sort of like just basic operational practices. Are you sending appointment reminders? Are you allowing for them to confirm and cancel those? Are you doing it in like the communication method they prefer, respecting their preferences? So like that's 10 to 15%. 15 to 10%, that's where you see a lot of this, like, when you start thinking about like supply and demand optimization, that's when you start to see a lot of that magic come in. And honestly, but getting between 10 and 5%, that's the difference for a lot of systems between being in the black and being in the red. So if you can work that down with both smart scheduling, closed loop engagements, wait lists, being open to some change, that's the business, right? That's the difference between being able to return, economics to the physician owners of the practice.
You got it, absolutely. And time back to the staff, friction reduced for the patients and the staff. I mean, there's nothing worse than walking in at 8 a.m., kicking up clinic in your front desk, taking all the voicemails of all the people not coming in that day or canceling that day, and you can't do anything about it.
Yeah.
Other than maybe
By
looking at a post-it note of a list of patients that want to be called in.
by the time it's the morning, the day up, it's already too late, right? And then there would have been that, 92-year-old grandmother who would have booked an open slot at 2 a.m. Like that absolutely happens.
You
If
got
you
it.
look into the Luma data, we get a really interesting picture of this. You see the usual, like for any kind of like web or consumer application, you see a lot of that, between 8 a.m. in Eastern time to 6 p.m. in Pacific time, you see the kind of a curve, but very different in healthcare, I think, than like, I don't know, Slack or Teams. You see this like continuous bar in the overnight hours where like people are like still consuming. They're booking online. They're rescheduling appointments. They're completing intake forms. The kids are asleep. Whatever those things are, they're making payments. They're doing all these sorts of things in the downtime, and I see that in my own behavior. I'm sure you do too. It's like, oh, it's not like literally I have my to-do list to move this appointment. I'm like, I'll get it through my wall of day. I have a wall of meetings today. I'll do it like in the evening. And, a reminder would absolutely help me get that done tonight.
You got it, absolutely. And there's a balance to best practice in the technology too. I've worked with a lot of organizations where they're like, "Well, we're broadcasting and we're reminding them." I'm like, "How often are you reminding them? How much are you broadcasting them? You suppress them too much." Like the natural, integration of the technology will keep them in access. It'll keep them in the workflow to get them ready for their appointment. Pushing out too many broadcasts, pushing out too many reminders, there's a cap and a ceiling there too of keeping that productive and
You
keeping
know,
patients in.
you travel a lot. I know I travel a lot, and you see some really interesting behaviors that I think are interesting that we can, you know, lessons I think from the airline industry we can pull forward here. So I fly United and American a lot, and United sends a 3 hour ahead reminder that my flight's coming. American sends a 4 hour. It's like, okay, that's an interesting choice. I wonder why that is. Conversely, they both send an email reminder the day before. So I got a message reminder, like one, like, when I'm like probably about when I need to leave for the airport. And then the email reminder saying, like, don't forget if you need, like, this is my capacity management message, right? So to your point, like, if you think about every opportunity you have to talk to a patient as having a reason where both sides see value. This is my capacity management message. This is my convenience message. This is my call to action message, right? If each one of these layer on together, there's actually value on both sides. And it's not just, I hate the clinics that are like, well, I want to send a message to the patient every, 20 minutes before, an hour before, 2 hours before, 6 hours. It's like, that's for you. The patients, that's not for the patient. So think about very much like, it goes back to your point on change management. Like, what are those behaviors you want from your clinic and your staff? And also, what are the behaviors that are valuable for the patient to have as well?
Yeah, that's exactly right. So we mentioned AI. I was going to say you, but I'm the one that kicked it off in the beginning.
You gave me an inch, I'll take a mile.
Everyone's talking about it. Hype, reality. Where are we actually seeing it make a difference in patient experience?
So it's if you ask, I go back to like lived experiences over the past 6 months. If you ask a bunch of physicians or CIO, physician leaders or CIO type leaders, like what does AI mean to you? You'll inevitably get two answers. Number one will be ambient listening, right? So like totally get it. We have a bunch of physicians in the family. They're all like, love it. Like I'm not charting at 9 p.m. So great, good. Like we've delivered value. Number two is call center voice agents. Like and, I get it, right? Like it's hard to keep call center staff. It's hard to train them. There's high turnover. And sort of one of the things I've been really surprised about in the last like 6 months is the creativity is kind of stopped there. And so you're asking hype versus reality and kind of like looking into that. And so I think we're starting to see in the AI, like things are in AI voice, whether it's ambient or phone calls, you're starting to see some good stuff happen there and like value being generated to people who are buying that, right? Either physicians by saving time, clinics by saving money and allowing for after hour service, all good stuff. There's a whole next generation of AI sort of stuff where I'm starting to see some things get really exciting around owning outcomes, owning the helping the patient themselves as they go on their journey. So I started as, we started Luma really help a patient from the moment they need care to receive care. The best we've done really is say, if this happens, do this, and then that, do this piece. And if it's exception, throw it in a person's hand and go figure it out. Okay, it's like it works. But can we get that 5% no show down to 3? Can we get it down to 2? I mean, we're starting to fight human nature here, but we have a human reasoning system, an AI reasoning system that can help us with this. So you're asking very specifically in like the world of like patient experience. I'm starting to see a lot of really cool technology, and especially like the GPT-5, 4.6 like generation of models, Anthropic series models, where you can actually make a lot of things happen in scheduling, in wait lists. One of the questions I get all the time is, can my wait list be optimized for revenue? It's sort of an icky topic, but I get it, right? Like ambulatory practices have to run businesses. Like if you take medical necessity out, and medical necessity always goes to the top, but I have two patients who are on par. How do I make a decision on who to get in front of me first? Normally that would involve some reasoning a human has to do. So like, or this patient only replies at 2 a.m., but I've got a slot at 5 p.m. and this other patient's 1 mile away. Maybe I should talk to them. So these are the kind of experiential things that we're starting to see get really, really exciting in kind of the next turn of the crank once this like voice sort of stuff is now starting to mature.
Yeah, that's awesome. Outcomes is one of those pieces where organizations are like, okay, look, I can't hire staff. I can't afford staff. I can't keep training staff. Call center's great. They don't call out sick. They work 24/7. They don't
Sure.
take vacation. So let's answer the phone calls. Um, but how am I going to help make sure that it can solve for X percent of my phone calls calling in? Or what are organizations seeing? And what is that going to do to bring revenue? That's the biggest question that I get
Yeah.
into an organization and adopting it. And so some of the barriers that I've seen is fear of how it works, fear of how people
100%.
interact with it, or the investment of it, how it's priced, different areas like that for an organization. What are some of the ways that you guys are seeing outside large organizations consider it, adopt it in, and kind of scale it over time, knowing that there's pieces of use cases, pieces of workflow that they can plug it into?
I think you had a nugget in there, which is like super astute. Like we have aligned AI typically to the cost side of practice operations.
Mhm.
Save me time, save me labor costs, save me this. Good. Okay. But we're now starting to see that evolution of, can I generate more revenue?
Yep.
And I found in 11 years of selling into healthcare that solutions that sell and problems at the top line are much easier to understand how to make those happen than problems to solve at the bottom line. Of course, there's room for both of them. That'd be crazy to say otherwise. But
Right.
really, what we're starting to see is at the top line of the P&L, like the revenue side of the equation, those are the sorts of things that we can actually apply like digital workers to. And I'll give you a really good example. Let's use diabetes and endocrinology for a second. Right, a diabetic foot exam is a critical part of diabetic management for people who are on who have severe diabetes. The best way that health systems and clinics, ambulatory otherwise, have tried to solve this is like pray and like smile and dial, right?
Mhm.
Or they're just firing off letters, right, saying it's you're due for your thing. Yeah, great. So all these health systems, whether it's your endoscopies that are due, whether it's diabetic foot exams, your retina exams, whatever these things are for like well management, health management, they've kind of sit and languished, and the best ability to service that demand has been dialing out that capacity, or messaging out the capacity, or sending letters out the capacity, or the demand, I should say. So
Mhm.
what we've tackled 5, 6, 7% of the available revenue that was on the other side of the equation. If we could converse with 100% of those patients, that funnel to convert to actually completed appointments and billable encounters on the other end of it, that increases dramatically. So that's this next generation I'm starting to see, because 2024, 2025, and really now into 26,
Yeah.
everything was focused on the bottom line.
Yep.
Digital workers, they don't get tired, they don't get all that sick. Cool, got it, lovely, makes sense. Great place to start. Now we need to flip the script. We're going to start at the top of the at the revenue equation, right? And say like, how do I generate demand at the right spots for the right patients, at the right payer mix for the right providers when the capacity is available? The
Mhm.
worst thing you could do, send a 10,000 patients a dial that says, or a text that says, schedule now, you're due. You're not
Yeah.
going to have capacity for it. Makes no sense.
Yeah. Yeah.
So being able to match that with actual capacity that's available, trickle those things out, drip campaign them, dial up when to, like, you hire a new doc. How are you going to get them, like, get their panel filled with diabetic foot exams? Great. Then you've got a patient population and a patient
Mhm,
panel. So all
mhm.
this sort of stuff on the top line, I think that's where we're going next. And I'm like, that's actually what I'm really excited about because the top line of the equation, that's the part I love the most.
Yeah, that's exactly right, and the systems have the data. We know what it's sitting there, right? We know what to go get, how to use it, where to put it, how to drive them into workflow for staff and patients. That true system of record driving into system of action, especially when you start to integrate these workflows and
Totally.
add this technology. The cognitive burden of a staff member saying, "Hey, this referral came in from a fax. I know that I need to get it coordinated. Let me file it first. Let me call the patient when I get to it," versus the data's there. We know it's sitting on file. Let's find it. Let's call the patient. Let's get them coordinated. Really starting to drive that. But that goes right to that top line of bringing revenue into an organization that was otherwise lost, sitting in a fax queue or sitting in a task queue.
So I like that's spot on. I think the other side of it is like, we're all patients, like I like to say, is would you prefer that you are in control of your own care or someone who doesn't have time for you, for no fault of their own, be in control of your care, right? I would love to like text message, self schedule, do all these activities so that and then my schedule changes. I don't have to wait for them. I get it, right? I've been inside of a clinic on both sides of the wall. They're
Yeah.
busy people. They're
Yeah.
like legitimately busy. And one of the hardest, like, it's a customer service job, right? In a lot of ways. And it's very, very hard. And I'm incredibly empathetic to it. So and the patients want to take some of the labor, right? Because they want to be successful. One of the one liners, I love one liners. I like to say is like, patients don't want to be engaged. They want to be successful, right?
Mm,
And so, like, let's let the patient be successful
yeah.
on their own. And, now we actually have some of the technology to enable that.
Yeah. That's exactly right. And you said something there where the patients kind of want to own their journey. They want to be successful in it, but they also want as much of a modern experience, but they also want that customer success experience too.
Yeah.
Sure, there's some opportunity where I want to be able to access it myself, be digital, be streamlined, get in there, get my care coordinated. But I still want that friendly hello as a patient. I still want to walk in and interact with staff quickly. I just don't want to interact with staff for 15 minutes to pay a bill at the front desk, right?
Yeah.
There's a balance of it. And so I think about some of the other barriers that when I work with these organizations and speak with them, they're like, well, I don't have front desk staff, or I need 100% touchless kiosk for check-in because we our patients don't want to interact with it. I yet have met a family member, a friend, or a patient in these organizations that don't want just at least that friendly hello check-in experience. They just want that A to C journey to be seamless and
That's
easy
right.
and modern, right?
I so the best version of this I've ever seen is like look at your local grocery store. There's all the self-checkout lines.
Yeah,
Lo and behold, there are still retail footprint service for
yeah,
someone scanning your bags. And
yeah,
so near me is a Sprouts, and I had all this like bulk bin stuff in my bag, in my basket. And like the woman's like, "Oh, don't do self-checkout. I'll be faster if you do it with me." I'm like, "Yes." Like this is a retailing experience that
yeah,
makes sense, right?
yeah,
I could choose to go here if I had a simple transaction. I just had, I need to get cereal or milk. But I
yeah,
had like, 16 bags of like bulk bin stuff because we're making granola. And
yeah.
so I was like,
All
you're
the
gonna be faster
produce.
at this than me
Yeah,
punching these numbers in on the stupid computer. So I
yeah,
get it, right? Like I'm the same way. And I think like different pockets of retail have really figured that out.
yeah, that's exactly it. Talk to me a little bit about how some of these issues or when you're working with organizations point to a quote unquote tech problem versus a workflow problem versus a culture problem and how we kind of, I mean, we're in this evolution of, I think it reminds me back to meaningful use, paper to EHRs, right? And we're in this world where we're getting to adopting this technology, figuring out the workflows, but not being so point solution and getting it more workflow embedded and helping to tell the patient where to go and what to do, or the staff member where it came from and what you should do next.
Yeah. So the kind of the evolution, at least the way that I see it, you have a being able to solve one problem is not sufficient, right? Especially go back to the comment you made earlier around change management,
Yeah.
right? If you have to do that level lift every single time for every single workflow, you want to talk about burning out your staff. You want to talk about burning out your IT team. That's going to be crazy making, right?
Yep.
Like you need core systems that can do multiple things. And it doesn't have to be one system, it could be a small number. But I'll tell you one thing, it cannot be an infinite number of things, right?
Yeah.
Like you're going to lose your mind in the process. So you think about a lot of these workflows and how you kind of can delegate some of them and automate some of them and make them available in a platform way. And there's like two things you got to keep in mind. Like number one is, do the systems work well with each other? Like that's table stakes, right? If they don't, like, shrug, move on, right? So number one, do they work well with each other? And number two, how consumable are they in both systems? And it's kind of a weird comment. But like if I am working in some AI voice tool and I can see the results of it happening in my electronic health record or my practice management, great. But if I want to get more details about like what was the reasoning the AI made when it suggested this, that's not necessarily sit in the medical record. So I can
Right.
go over there and it has all the information on the other side as well for the kind of domain specific stuff. But the
Mhm.
appointment got booked or got rescheduled or the intake form was complete, and that needs to live in the health record or the practice management system. So I think integration is always really really critical, but also making sure the systems are doing are talking well to each other. So I think that's sort of like the key elements that I would think. But underneath that is really that core essence of there will be more than one system, right? I mean, in Luma, we have HubSpot, we have Salesforce, right? Like
Mhm.
those are overlapping systems. But they each have their purpose and they all talk to each other, right? They talk to our Gong, they talk to like all these different systems that we have, our, you know, call quality tools, like all these sort of things, but they all do integrate, but we don't have 300 of them. And every
Yeah.
time, and it's funny because like we'll have leaders in the team saying, I'd like to buy this tool. And, IT and CFO says, no way you're not. Like, just come on.
Yep.
Like, ask the other vendor if they can do more for you. Lo and behold, many of them can. And
Mhm.
I think that happens in any kind of solution, which is, your one vendor can likely do more. You just haven't thought about asking about it.
Yep.
And especially, just going back to what you're saying a little earlier, Jen, is we're talking about AI. A lot of the vendors, like, I know, both our organizations, we have a bunch of AI solutions and, we're happy to talk to you about them. And are they going to be like, have the slickest marketing and the fanciest stuff? Like probably actually, yes. And, but you didn't know to ask because you've had someone else banging on your door saying, try my shiny penny. So
Yep.
like as any advice to any practice leader or, CIO type or whatever it is, like go to your core systems, go ask them and push on them really to say like, can you build these solutions for me? Because I'm a healthcare system. I'm a practice. I'm actually not an IT shop. My job
Yep.
is to do this. It's not to do that.
Yeah, that's exactly right. That kind of takes me to my next question, and we may have touched on it, may not, but I'm curious. What's one patient demand that organizations are not paying enough attention to yet?
Ooh, you said one, so I'm really gonna have to think, which is never gonna be my forte here to give you one. Like I said, give me an inch and give me a mile. So I would say that I will say this from my own seat, and then I wonder if you would actually have a similar thought here, which is being able to ask a question after the appointment.
Mhm.
That is like such a tough thing in healthcare. I got rushed out. I had 12 minutes with the doctor, 5 minutes with the nurse afterwards, and I forgot that one thing. And it was hard enough for me to get, and I guess that maybe that, like, yeah. So I'll use that as like maybe an allegory for the rest of the journey the patient goes on too. The reason that's such a like a hard thing or so precious is it took me so much work to get to the doctor in the first place. I don't want to do that again. I
Yep.
don't want to go through the 6 weeks to go ask the follow up question. So I'll give you this really good like story here, which was my GI doc. I've had to see my GI like 4 or 5 times. After the second visit, he's like, it's just not worth you coming in downtown Dallas every visit. Just send me a message or like call me. It's just like
Yep.
not worth it
That's
for
great.
both of us at this point. I was
Yeah.
like, wow, like what a patient friendly way of doing things because my entire lived experience with healthcare is like, great, we'll get you in the calendar. Great, we'll get you in the calendar. And I get that, right? Because it's like build encounters, like all this sort of stuff. You can build like, the right CPT code and like there's reasons for that. But from a patient's perspective, I could actually ask the follow up, like, "Hey, I got this test result back. It came to me via LabCorp portal. It didn't end up in my GI doc. And I literally just like sent him a screenshot. He's like, you're good. I was like, wow, that was great. That was actually a really positive experience. So I
Yeah.
think being able to, like, we never really talk. And I guess this is also going to be partly antithetical to what I was saying earlier because we focus so much on the top line, which is getting butts and seats. The patient experience, like their journey with healthcare doesn't stop after the appointment.
Mhm.
So like
Yep.
how we don't address that much. Like I would say like that's a blind spot for what the work that I do.
That's exactly it. Yeah, I mean, you took it to a very specific workflow, which is awesome. I was just gonna broadly say patient communication, which maybe that's a cop out, but the reason for that is I think people are just still so fearful of AI, the buzz of AI, and I don't know I don't wanna revamp my whole call center, but they're missing that aftercare call in or that text message back in, to your point, or the understanding of the volume of the calls that come into an organization. The average organization, 60% of them are just to manage an appointment. Where
Yes.
is it? How do I get there? Who am I seeing? I'm coming, I'm not coming, reschedule me. All of that time, 60% of that time, the staff is answering, calling back, listening to voicemails. And so I think there's just this low hanging fruit that brings in such an ROI for time, frustration for both staff and patients,
Oh, yeah.
revenue by keeping them coming in their journey and keeping them in that good experience. I know if it's easy for me and I can get my questions answered, if someone will pick up a phone, whether I realize it's an agent or not, I'm going to keep going there. I'm going to
Yeah.
keep being a patient in that organization.
Yeah. I mean, if you think about it like that, you are generating long-term value for that clinic by providing good service, right?
Yeah.
And
Yeah.
here's like using your stat, just riffing on it. If 60% are, and they are like scheduling related, appointment related calls, that means if you take those off and automate those, because they're all very procedural, AI can do all that. That opens up the time to actually do the stuff that we're like, hey, what was the dose of the medicine I was supposed to take? Like
Hmm.
those sorts of ones where you do want a human to talk to somebody. Like
Yep.
there's such like low hanging fruit. And I think you were saying like fear, really, to underline some of the words you were using earlier. The fear on AI, a lot of it, like, well, let's not do the scary stuff,
Hmm.
right? Like, we can book an appointment. We've been booking appointments online and digitally for 15 years now. Like, just because you're doing it with voice or over text doesn't make it magically different or better. It still follows the same practice rules, the same engagement rules, the same rescheduling rules. It sits on the same platform. So why not let AI do the easy stuff? Like, and then
Hmm.
let the humans do the stuff that humans are exceptionally good at. Patients win because they can solve their problems and they get more time on with the staff for the problems they want to spend with humans.
Hmm. That's funny. Yeah, it's exactly right. I went to my dental appointment last week and I was talking to the front desk about a piece of paperwork that I had sent through online, and I said, "Yeah, and, Lucy called me, and I answered a few questions for her, so it should all be good." And they kinda looked around at, like, "Who's Lucy?" And they realized it's the phone system, and at that point, I realized that I talked to an AI agent, and I didn't even know it.
That's insane. Yeah.
Yeah,
I
it's
mean,
pretty
and
funny.
was it a positive experience for you?
It was a great experience. I
Yeah.
mean, it was a quick minute at the front desk of, "You've got what I need. I answered your questions. Do you need anything else?" They're like, "We'll get you back." And I was back with the doctor in 5 minutes, or
And that's
dentist.
all that's what you want as a patient, right?
Yeah, it was great, great. So, I have one more question to kinda lead us, and it's another big one, I apologize. But what do you say will define a great patient experience 2 to 3 years from now?
In 2 to 3 years, a great patient experience will be one where everything they wanted to self-service was available in their fingertips, and when they wanted somebody to help them along the way, they were available to get help.
Yeah. Yep, I
So
love it. Yep.
schedule, reschedule, get my RX refill, get all that sort of stuff. But when I had like my knee is hurting in this specific way, like I
Mhm.
want to talk to a nurse or mid-level about that. Like that's the conversation I want to have. That's and then talk about the best experience you could possibly have. Like you're
Yep,
on your way to healing faster, and when you're concerned in those dark moments at night, there's someone to call and talk to.
yep, you got it. Well, I know that we didn't even hit a bucket of topics that we could keep talking
Should we
for.
keep going for another hour? Let's do it.
But it's been a wonderful conversation. I really appreciate you joining the show today and appreciate you and your support. But listeners, thanks for making time today for today's episode of In Practice. Be sure to subscribe on Apple's podcast or Spotify to never miss an episode. Until next time, thanks so much.
Thanks for having me.